Hello, my name is Michael George of Sagesse Healthcare Consulting, and welcome to the Pioneering Patient Podcast. Today, my guest is someone who 6 years ago lived through what he considered to be a nightmare. He was diagnosed with a heart valve condition and had surgery. He thought on at least one occasion that he was going to die, and he even said goodbye to his daughters, thinking that it might be for the last time. It's a trauma he's still living through, but he's using that experience to good effect to help other patients in his role as CEO of the German patient group initiative Herzklappe. I welcome Jens Näumann. Jens.
Hi, Michael.
So, Jens, as we come to this tale, we'll come to this tale shortly, but first tell me more about Initiative Herzklappe, the patient group.
Well, we're a German patient organization based in Berlin. We were founded in 2019. That was before my time. I joined Initiative Herzklappe in 2020. And the aim is to educate the general public about symptoms of heart valve disease and, well, hopefully raising awareness because, heart valve disease is common, it's treatable if early detected. So this is, I was going through a nightmare. So this is what I want to prevent for others. I want to help others to not going through that nightmare. And so, yeah, we are trying to raise awareness and, well, accompany patients on the whole patient pathway from early detection until follow-up care.
Yeah. And you describe your experience as a nightmare. You were diagnosed with bicuspid aortic valve, which is a congenital condition. But did you have any inklings or signs that you had a heart valve condition before this?
When I was a child, our family doctor told my mom that she heard something. There was a murmur. And my mom asked her, what can I do? Do I have to do anything else, go to a cardiologist or whatever? And she said, no, that's a lot of kids have things like that and you don't have to do anything. So when I later on, I was very active, but later on when I was, 21 or something, I went to China studying Chinese language and culture. And there, if you enter a university or apply for a university, you have to this health check. And there was a doctor and she auscultated my heart. And she said, okay, I can hear something. As soon as you come back to Germany, you should check with a cardiologist or a GP, just check it. And I didn't, of course, because I was 21 and I had other, plans.
Yeah, exactly. And because you were very active, tell us about how active you were as a young man.
Yeah, I'm a big football fan. VfB Stuttgart is my team, so my wish was to play in the youth league of VfB Stuttgart, and I finally succeeded. I was there, 5 years or something. I was pretty good, but then competition was getting harder, and I didn't make it. I was so active that when I was 14, I rode with my bike over the Alps to Lago Maggiore from Stuttgart, which is quite a long distance. Took me 2 weeks to go a return trip. And also, not only football and riding bike, table tennis on a high level, I would say, and also other kind of sports. And I really enjoyed that, yeah.
And in terms of work, you were getting on with your work, you're building your career, you're building your qualifications, doing other work that was helping others in their hour of need. Is that right?
That's right, yeah. Well, when I was in China, I worked for a political foundation. This is now pretty helpful in my job because I know how to, get in touch with politicians, and I think I know how the system works. But I think it is important for me. It is important to help people, and I tried to help people who were not successful in They were not privileged like I was, so they didn't have education. Jobless people, I tried to help them find a job and make something better out of their lives.
Yeah. So you're getting on with your life, being active, doing a great job. But when you were diagnosed, you thought you were symptomless. But in hindsight, do you think that wasn't quite the case?
It was definitely not the case. Now, in retrospective, I know that it was completely different. And the thing is, this is what I'm telling other patients, or try to, when I raise awareness, try to tell others that you get used to your symptoms and you adapt your life to these symptoms. Of course, you don't want to get a bad diagnosis. So yeah, you try to avoid everything which, well, I did. I tried to avoid everything which was connected to this diagnosis. And well, definitely I had a lot of symptoms. But you get used to it, and I didn't want to, well, didn't want to see it. Yeah.
Yeah, yeah. And give me an example of the way you might have adapted your life. I mean, you lived in a 4th floor, I think, apartment, didn't you?
Right, in the Berlin apartment, 4th floor, which is quite a lot of stairs climbing. Well, you know, I had 2 small kids, and when I picked them up from kindergarten or whatever, yeah, it was quite difficult to, you know, carry one kid and, for example, groceries, you know, that was not possible. So I tried to avoid this situation, but still it was difficult because I couldn't climb to the 4th floor without making a pause, without pausing, because I was I had shortness of breath.
Yeah. So you were 42 when you were diagnosed, which is young for a heart valve disease patient. Now, many patients I talk to will talk about their experience. They say how they got diagnosed, they got treated, they're so pleased and so grateful, and they want to tell their story so others can benefit from that. In your case, it's almost completely the opposite. You didn't enjoy that experience. The experience hasn't been great for you. You're still living through that trauma. That's right, isn't it?
Well, I'm grateful. I would say I'm grateful because I can live a normal life. But the process from being diagnosed until, rehabilitation was not that nice. It was not. It was not a good experience. Well, I can use the experience now to help others. That's good. But I suffered a lot because I thought I'm going to die. Because there was no explanation what would happen to me. Nobody talked to me and explained things, so that was quite difficult for me. Yeah.
So it's the summer of 2018,
Yeah.
and you go to your new GP who diagnosed you, but she didn't even need to use the stethoscope, did she? Tell us more about that.
Well, she used the stethoscope because she didn't know me. Well, my old GP retired, and there was this new one. And she was shocked, and I thought, okay, why is she so shocked? But yeah, she told me. I said, that's impossible. You must be wrong. And she said, no, I can hear it without a stethoscope. Just going with the ear near to my chest, and this was quite shocking for me. So she picked up the phone and organized an appointment at a cardiologist. Yeah.
So you had an appointment on 1st of June. And you almost forgot to go because you were so busy, but you had a real shock when you went there.
Sorry, it's not funny, but yeah, I've almost forgot to go there because I made plans. I was applying for, several things and yeah, made plans. And then I realized, oh, I have to go to this appointment. And then they did this echo thing. And there was maybe it was a young cardiologist, and he, said, okay, everything is okay. And then he, after a while he said, oh no, there's not everything okay. Maybe we should see us twice a year. And then finally he said, okay, no, you need surgery as soon as possible. This was, well, it took 5 minutes from you're okay until, okay, you're almost going to, it's very serious. So that was shocking for me. And I didn't trust him because this is not normal. Yeah.
No. So you wanted to get a second opinion. You thought this wasn't right. You were in denial. So you went for that second opinion, but it was more shocking, wasn't it, really? What were you told and what happened?
Well, first of all, it is not as easy as you think to get a second opinion, because the day I was operated was the day when I got the regular appointment at a cardiologist, another cardiologist. So I used friends to get very quickly another appointment, and that was shocking, because she also, this cardiologist, she didn't need a stethoscope to hear that. I still can't believe it, but this is what they told me. And I asked her, okay, what does that mean? I mean, she said you need surgery, but what does that mean for me, for my life, for my family? And the answer was, well, we could managed to lower the mortality rate in the past 10 years with this kind of aortic valve surgery. You know, that was too much for me, so I fainted. And yeah, I was out of order. I just, you know, fainted.
Fainted because you thought that was the
I'm
end?
going to die. That's it. I don't know. I didn't know that was really a shock for me. I didn't know how to explain my kids. My wife, okay, I could. It's also difficult. But kids, they were 9 and 6 years old. That was too much for me. Yeah.
And then there's a period of a few weeks leading up to that surgery.
Yeah.
You would speak to your doctor friends, you speak to others, and their sympathy made you even more worried, didn't it?
Yeah. I mean, if a doctor is worried about you, it must be very serious. So it was a terrible time. It was 6 weeks from diagnosis to treatment. And on the one hand, it is good that it was so quick, but on the other hand, I didn't have the opportunity to prepare for this operation.
And it was particularly impactful because the day before your operation, you took your daughters to your parents' house. And what happened then? You had to say goodbye.
Yeah. Well, my parents live in Stuttgart. I lived in Berlin at that time, so it was quite a distance. And my wife and I took my kids to, because, you know, this is another important thing. You have to organize the operation. That means the time after the operation. That means it is not clever to see your kids on the first couple of days because you look terrible. You have hoses everywhere, and it's not nice. So we planned to bring them to my parents' place, right? And I said goodbye to my kids because you never know what happens, and it was. I mean, they cut your chest, they open your chest, and this is the most important organ. So I'm not a cardiologist or a doctor or anything. So I thought, okay, you have to be lucky to be healthy again. So I said goodbye to my kids because
you did
better do it.
Yeah. So you acknowledge that the people treating you, the doctors, were of a high caliber. That standard is always there in Germany. But what was affecting you in that relationship with them? It's a kind of lack of control, wasn't it, that was important?
Well, yeah, what they told me is what my cardiologist told me. And at that time, I thought this is really helpful. She said, you should get rid of the control, give the control to me. I will guide you through the whole process. But the problem is that doesn't work. It's a relief if you, give control to someone else. But it's not helping because when I stayed in hospital, I had a lot of questions and I couldn't. They don't answer the phone. So there is no guidance, there is no help. They just decided what kind of valve they put into your body. But losing control or giving someone control is on the one hand good, and you have to do it because you are not a cardiologist or a surgeon. They are the experts. But on the other hand, I think now you should understand what is going on with your body, what is going on in the whole process. And also life with a mechanical valve is different to other valves and very special. So you should understand what you are facing, I think.
Because you do a lot of work now in shared decision making. In fact, you're leading on behalf of patients in shared decision making, but you didn't have this then. So what were you told about your choices?
There was no shared decision-making process, not at all. They said, okay, you have two options. Biological valve, then I will see them again in 15 or 10 years. I didn't want to see them anyway, but again. And the other option was mechanical valve. Then I had to take, or I have to take, because I have a mechanical valve, anticoagulation and for the rest of my life. So these were the two choices they gave me. The important thing is not only having a choice, but understanding what is going on. And this was not the case at all. People they don't have options. They survive and they can hopefully have a normal life, but it's not, the outcome is not the same. If you have a choice, if you understand what's going on, and if you agree to what is going on, or what they decide is going on, the outcome is much better. And I think also the psychological thing is much better.
If you'd had shared decision making, is it possible you made a different choice and it might have been a different outcome for you?
Difficult to answer, but probably yes. Probably no, I don't know exactly, but I would have thought much more about what would be the right treatment and the right valve for me. Because if you have a mechanical valve, well, anticoagulation is not a problem for me, but the clicking or ticking, the sound, there are people, I spoke to patients, they try to commit suicide because they can't stand it, and you can't get rid of it, because if you get rid of it, I don't have to tell you.
So you had the operation, it was August, very hot time. When you came around, I think the next day, it was a bit surreal for you. It wasn't easy at all, was it?
I just asked myself, is this heaven or hell, or where am I? I don't know. I was lying on a corridor in the hospital because it was the hottest day in the year and there were a lot of heart attacks, so they didn't have enough rooms. The intensive care, or I don't know if this is correct, was full, so I was lying on a corridor and woke up, and well, there was this guy and he asked me, he didn't say, okay, everything is fine, you're okay. He asked me, do you want to have ice cream? And I said, what? Ice cream? And he said, yeah, okay, give me ice cream.
And you were actually operated on twice because it didn't go exactly according to plan, which was difficult, but also your wife wasn't sure what happened to you.
Yeah. The communication in the hospital was terrible. And I woke up 27 hours later or something, and my wife didn't know. She was called and said they told her everything is fine, and then she wanted to visit me in the evening, and then I wasn't there, and she asked where is he, and they told her that there's a second operation. And at first they didn't know where, they couldn't locate me. They didn't know where I was, and I was in the second surgery, and so she thought I was, not living anymore. So this was quite shocking for her. Yeah, it was terrible. Yeah.
You were spent a week in that hospital. You had to go to another hospital for 2 further weeks, but you were desperate to get to a celebration for your daughter going to a school or new school.
Yeah.
And when you got there, it was great you were able to get there. What were your friends and others telling you about how you looked at that point?
Well, I was happy that I succeeded and that I got off hospital. The time in hospital was not so nice. I was happy to got released on time, and I was still very weak, and I looked very pale. I don't know if this is the right word, but and a lot of people were shocked because they thought I was 20 years older than before, and there was all this burden of psychological burden, but also, heart-lung machine, 27 hours, or maybe, I don't know exactly if 27 hours, but a long time in coma, artificial coma. Everybody would have, would not have been in the same shape than before. So, a lot of people asked me what happened because they saw obviously there was something wrong. Yeah.
So physically you were getting better, but mentally it hasn't been, psychologically it hasn't been quite like that, has it? You almost talk about two lives, your life before the surgery and your life after.
Yeah, there are definitely two lives, and a lot of patients say, we did a survey on that as well, they say they feel mobile and they feel physically fit after the operation very quickly, but psychological burden is very bad. And it was not good. I got panic attacks. I was always, anxiety was a big problem, and it still is sometimes. But I don't know. It was, my first job after the operation. I realized that I'm not able to do the same thing as before, and I thought that this could be the rest of my life. So I was really worried, and I can reassure or encourage others if they have these kind of problems. Try to get help, because it's not it's bad, but it's, you know, there's a solution for it, and it's getting better. It's really important to understand that, because if you don't do something, it can become a depression, and then it's not that easy. Yeah.
So after your procedure, you were working in one role, but then the opportunity came to become CEO, the first CEO of Initiative Herzklappe, which is excellent because you got the right experience for that. But it's also a conflict for you, isn't it, in a way? You're helping patients, but also a reminder in a way.
Yeah, it is a challenge, because it's not doing 100%, but 150 or 20, and it's not because there's so many things to do, but it reminds me a lot of when I talk to a patient and I see there's anxiety and there's all this, you know, uncertainty, and it reminds me of my situation.
But there are benefits in helping patients, but also working with that community, international community of people who understand what's happened because they've gone through the same thing.
Yeah, it's fantastic being with patients, not only because you can achieve more, but also because, you know, if there's a patient, you I don't know how to say in English, you get very close to each other. There's I don't know, you understand each other much better because you have the same, well, I don't know, challenges or maybe similar challenges, and you almost, well, you were thinking about death, about not being here anymore. And this is something which unites, because, yeah, and it's very good. I have a lot of people inside the global, or with the Global Heart Hub, where I can exchange my experiences and just see that, well, you know, some situations I thought I was the only one, but I'm not. Everybody has the same, or not everybody, but it's, you know, it's common to have problems.
You've been treated, it's giving you the impetus to try and change things in the healthcare service to achieve as other patients, as you've said about other patient groups. So tell me about the things you really want to change in the German healthcare system.
Yeah, I'm smiling again because one of the major challenges is to change, well, even tiny things in the German healthcare system. It's really difficult. But if there's one thing, there's several things, but if there's one main thing, it's, you know, to get patients on eye level with other stakeholders within the system. And this is not the situation right now. It's, you know, we as patients are not allowed to, well, understand, to ask questions. Well, of course they are allowed, but it's not, there's such a strong hierarchy, even within the medical experts, and the patient is, you know, is not on the same level, and it's very difficult to get serious answers, or to get they don't take you seriously.
So you talk about the hierarchy and the difficulties. What are the negatives of not bringing in that patient perspective, and what will be the benefits for the healthcare system of treating you as an equal stakeholder?
Right. Well, treating patients as an equal stakeholder, the benefits are, in my opinion, obvious. The outcome would be much better, and there would also be a relief of burden for, you know, doctors, because if you have patient organizations who speak the same language as patients, that would, well, it would be so easy, because they could educate and they could guide the patients through the pathway. So this is definitely a benefit, a strong benefit, in my opinion. And yeah.
You've done some great work as an organization on shared decision making, early detection, the patient pathway. Talk about that and how that can benefit the healthcare system in Germany.
Well, yeah, the shared decision-making thing is, as I said before, well, in cooperation with the Global Heart Hub, we did this guidelines for shared decision-making, and it's very helpful for patients, because they can look up what should a shared decision-making process look like. So this is good for patients, but it's also good for the healthcare system, because surgeons and cardiologists, they don't have the time to explain patients, or maybe they have the time, but they don't speak the same language. So this is a communication problem, in my opinion. So using these materials, like the patient pathway report we did, which focuses on gaps on the patient pathway, which is early detection. And early detection is not good in Germany, in cardiovascular disease in general, but also in heart valve disease. And it would help because, or it is helping because we have suggestions how early detection could be improved. And if you educate patients and they understand in which condition they have, they could advocate, they could speak for themselves, but also they can understand even more. And this is a time benefit for the healthcare system and for doctors as well. So integrate patient organization and patients in guiding patients through the process would be very helpful.
And you talk about shared decision making so importantly. Now, your cardiologist said, give up the control, give it to me. What should that cardiologist be saying now?
In an ideal world, explain what is going on and what are the options and what does the process look like, and giving a contact of a patient organization to speak to people with lived experience would be very helpful. Because, you know, a doctor, okay, they can do a lot of things, right? And they are clever and they know how to articulate themselves, but they do not know how a patient feels. So my cardiologist should have given me a patient organization name, which didn't exist at that time, but exists now, and giving the opportunity to speak with people with or to people with lived experience.
Yeah. So you're ready and able to help those cardiologists in the future, which is brilliant. Now, if you look 5 years ahead, what do you want to achieve for heart valve patients, for you and your family even? What do you want to achieve over the next, let's say, 5 years?
Well, I think the most important thing is that people understand the symptoms of heart valve disease. This is one thing. A very important thing is to improve early detection. This is something we're working on, and we're already successful. There must be auscultation of the heart on a regular basis. It must be. And other things are, you know, as I said before, putting patients or achieving that patients are on eye level with doctors. Eye level is difficult because if you say eye level, doctors don't like it because they are the experts, and let them think they are the experts. Patients are the experts of their own disease. So this is something, you know, it could fit perfectly.
Jens, if you were speaking to someone now, as you do, a patient, who's going through the same experience as you, what advice would you give to them?
Yeah, a lot of advices. Shared decision making is really important. Bringing someone to doctor's appointments is, I think, crucial because you just understand half of what have been said if you are in this, you know, overwhelming situation as a patient, and you forget a lot of things as well. So if you have a loved one or someone you can trust next to you, it's very helpful. But get a second opinion, shared decision making. Try to understand what that means and bring someone who supports you, and ask as long as you understand.
Jens, thank you very much for what you're doing for patients. Thank you very much for your story. Thank you.
Thank you, Michael.
Thank you very much. That brings us to the end of this edition of the Pioneering Patient Podcast. If you have ideas for future podcasts, please send them to me in the email at the end of this show. Thank you for taking part, and remember, take good care of your health.